Good morning, good afternoon, good evening, wherever you are in the world today. Welcome to the fifth session of the Western Pacific Climate and Health Responder course. I am Renzo Guinto, Associate Professor and Lead for the Planetary Health Initiative of the SingHealth Duke-NUS Global Health Institute at the Duke-NUS Medical School, National University of Singapore, and I will be serving as your moderator for today's session. This session will focus on the topic climate extremes, agriculture, food, and water security. For our learners, I would just like to remind you all of the course objectives, and let me read them from the slide. To increase health professionals' knowledge, self-efficacy, and communication skills related to the climate change and health nexus. To expand global workforce capacity, to develop and implement educational programs on climate change and health, and to build and strengthen an agile and informed community around climate and health education, advocacy, and policy. As mentioned, we are already on our fifth session in this course, so we're halfway throughout the journey. And as you can see, we've already tackled several topics for the past several sessions. And again, today, we will be focusing on the nexus of climate, food, and water. And for this session, let me read to you the specific learning objectives to describe how extremes of temperature and precipitation are affecting water security, food security, and malnutrition in the Western Pacific. To explore mechanisms for forecasting food and water insecurity using climate models. To explore examples of strategies to improve food and water security in a changing climate, and explain how climate change affects all four dimensions of food security, such as availability, stability, access, and utilization. So let me just share with you some logistical reminders. I'm sure you've heard some of them or all of them already in the previous sessions. This is going to be a 90-minute session, which includes expert lectures and case study presentations. Sessions will also culminate with a question and answer section. So please be ready with your questions. We would love to have a vigorous discussion towards the end of this session. And so enter your questions for the presenters in the Q&A box. Just a kind reminder that sessions, video recordings, slide decks, and resources will be made available on the course website. And of course, I can see that we have around more than 600 learners from across the Western Pacific already have joined the Zoom. And attendance is automatically recorded during the live Zoom sessions. Your individual attendance is only counted if you join using your personal Zoom link. Your attendance is not counted if you join with a colleague's link, and YouTube videos or views will not count as well towards your attendance. So it's very important that you are present in the Zoom, and a certificate of participation will be given to you later on if you attend more than 70% of the live sessions and also pass the final exam with a score of more than 70% at the end of the course. And note that the certificate of participation, again, is only available to people who use the same email for the registration, all Zoom sessions, and exam. And if you want to prepare in advance for the final exam, here are some reminders that the exam must be completed, again, using the same email address. The exam link will be sent on the final day of class via email and WhatsApp and will close on Sunday. The format, it will be a 25 approximately multiple choice and true or false questions. And again, participants should be prepared to take the exam in one sitting. So please take notes, pay attention, and once the materials are available on the website, feel free to review them all. So now let's begin. And I am very deeply privileged to be with two of my amazing colleagues who will be sharing their expertise on the intersection between climate change, agriculture, food, and water security. So first, we will be hearing a lecture and a case study from Teo Lau Dr. Viliamu Iese. He is a senior research fellow at the School of Agriculture, Food, and Ecosystem Sciences at the University of Melbourne in Australia. He has conducted research and published widely in the field of climate risk resilience in agriculture, the impacts of droughts and extreme events on food systems and livelihoods, diets and health, climate change loss and damage, and evaluation of climate change adaptations, especially in the Pacific small island developing states. He is a member of the Food and Agriculture Organization's Global Hub on Indigenous Peoples' Food Systems, also a member of the Asia-Pacific Scientific and Technical Advisory Group to the United Nations Office for Disaster Risk Reduction, and he also wears many different hats. So we're very, very glad that Vili can join us and give a lecture this morning, today. And then he will be followed by Dr. Victoria Keener, who is a senior research fellow at the Iese Center in Honolulu, Hawaii. She is also a research professor at the Global Institute of Sustainability and Innovation at the Arizona State University. She is a co-lead principal investigator of a NOAA-funded Pacific Regional Integrated Sciences and Assessments Program. She earned a PhD in agricultural and biological engineering from the University of Florida, specializing in hydroclimatological research. So we have Vili and Victoria, both V's, to share with us their expertise on this important topic. So without further ado, let's give a warm welcome to Vili. Vili, thank you very much for joining us.
Hello, and well, good morning from Victoria in Australia. And thank you very much, Professor, for the warm introduction. And, hello to everyone joining this course. I hope you can hear me.
Loud and clear, but maybe we can ask our colleagues to put up the slide deck. Thank you.
Can you see my my screen?
Yes.
Please confirm. Okay. Wonderful. Okay, so let me do my final departure checks. Okay, so thank you very much for this opportunity, and talofa everyone once again. I'm giving this this lecture, and I call it Accelerating Food Production for Food and Nutrition Security in a Changing Climate in our Pacific Islands. So there are two important things we'd like to cover before we move on. One is that discussing agriculture, food, and water are really, really huge sectors, huge topic to cover in a very short period of time. So I'm going to focus this talk a little bit on the food system approach, because that will enable me to bring all of these important topics together and trying to nail down some of the important messages I want to share with you all today. And the second important message today is that we will continue to enjoy talking about the Pacific. So all the examples and some of the contextual information I will provide will be mainly from the Pacific Islands experience. So just to start this talk, I want to give you a little bit of a story my great-grandmother used to share with me, and this is about the culture of resilience and the migration of our ancestors, mainly the Polynesian groups, that settle the Pacific Islands, but it's also relatable to other cultures around the Pacific. And my great grandmother used to say that the culture of resilience, the culture of our Pacific Island people, is based on the anticipatory capacity that they have. They anticipate the risks and act accordingly to reduce them. And this is really fundamental for our mentality and our capacity as we go through this lecture. And I'm sure, as well as with this course that we're doing. So before our ancestors decided to leave about 4,000 or 5,000 years ago from Southeast Asia, group of villagers there decided to sail eastward to the Pacific direction. They anticipated some key important realities they were going to face. The first one, they anticipated a rough journey, stormy weather, strong currents they were going to face, and they prepared themselves accordingly by building seaworthy canoes. And according to the early explorers from Europe who visited the Pacific in the 1700 and 1800, they said those canoes were really amazing. They rolled with the current and then went through the waves. So they were really strong and superior designs. They also anticipated a long journey. So they prepared themselves by developing technologies and knowledge systems of storing foods, water, and back the fishing gears, knowledge of fishing and processing foods, so that they could rely on during the journey on the high seas. They also anticipated landing. These are brave ancestors, and they were not just going to enjoy the sightseeing. They were pioneers, so they prepared by taking planting materials, livestock, including the knowledge of cultivation, cooking, and utilization of foods, knowledge of forecasting, using all of the stars and the currents, the migration of birds, and also the knowledge of disaster risk management, and also the knowledge of medicine and the medicinal plants that they took with them. And important points to make here in this culture of resilience, these ancestors and the components of our cultures enable them, or they build a system to prepare for multiple hazards, to prepare for multiple risks, not just a sectoral, for multiple risks in a systemic approach. And the foundation of that, the resilience in our cultures, was based, they managed to do that because they had the appropriate knowledge, technology, the human capacity, the resourcing, and all of this information were available that enabled them to make informed decisions before they left, during the migration, and when they landed, and then make more informed decisions as they settled these islands. And during the migration as well, in that time, it was a time where they had the values of living in harmony with each other and nature. And then their canoe was more of like the only lifeline for the pioneers at the time. So they look after the canoes, they maintain the canoe, and the house of the canoe was very important to them. So when they landed in the Pacific Island countries, they look at the islands as the only lifeline for them, the islands and the ocean around them. So they look at them and they like the way that they maintain and sustain their canoes as well as their only lifeline. And that was the key to sustainability. And also in that migration, it takes three people to sail a canoe. This is a famous story from the Republic of the Marshall Islands. I'm not going to share it now because of time constraint, but it's understanding different roles on the canoe. And then from different, there is a navigator, there is a steerer, there is a person looking after the sail, but they all can work together based on their strengths, not their weaknesses. And they complement and make a very strong team. I'm saying this as well because that's the culture of resilience during the migration and the ancestors. But right now, we have shifted the culture of resilience and this attitude from the culture of resilience to the culture of vulnerabilities that we have now, from the culture of independence to the culture of dependency. from the culture of risk-informed decisions, where the main question was what if, to the culture of regret we have now, which is the main question, or the main statement is if only I thought of this. And that's me on the canoe. I always say that was taken 2 weeks ago, because I always reflect to myself that I can't even build any of those canoes. I get seasick on the boat as well. So there is a shift in this culture. But if we have to talk about climate change and health or agriculture or building resilience, we have to reclaim this culture of resilience. And this is just contextual information of Pacific Islands, where those early navigators settled. We have the Melanesian group, and then we have the Polynesian islands all the way up to Hawaii, and we have the Micronesian group of countries as well. And these are some of the most vulnerable countries in the world, highly exposed to natural hazards. It's also located in the Ring of Fire, on the biggest ocean in the world, and there are more seas and less land. It's only about 2% land. But these are some of the most beautiful places on Earth, and most resilient people as well. So I want to start talking about this before I just briefly go through the food system. It's important to look at food systems approach when we're thinking of how we could achieve food security, because the definition of food security itself, according to the FAO, it's more of a goal and a vision to work towards. And it says it exists when all people at all times have physical, economic, and social access to sufficient, safe, and nutritious food to meet their dietary needs and food preferences for an active and healthy life. And if you listen to this definition, or you look at this definition, it sounds like a very UN definition. It's trying to cover everything. But how are we going to achieve that? Working on the food systems and building the food systems is a pathway for us to achieve some of those 4 pillars that was mentioned by Professor before. Because we work on the food system, it's a key or pathway to make food available, accessible, easily utilized, and also very stable supply system. And those are the 4 pillars of food security. Unpacking food system a little bit, because I was saying that speaking about agriculture, water, and food, they are massive fields, different sectors. But looking at it from the food security, the food system approach, we'll be able to bring all the sectors together. And we look at the physical, economic, social access. That is mainly the agriculture, fisheries, forestry, and also the trade and customs and some of these supply chain processes. We look at food utilization, that's mainly the health group, looking at the nutritional value, looking at the social value, and the food safety policies and legislations, and also monitoring. And then the food access coming into the socio-economic elements. So it requires everybody to work together in this framing. And the second part about this is that the food system involves many actors. And we know we have a proverb in Samoa, it's like many hands lighten the work, lighten the load, but sometimes too many hands can spoil things. So it requires really good coordination and good communication. But the first key here is to be involved, but understanding who the different actors are. But these are the type of actors that can actually do the real action, not the type of Hollywood actors and Bollywood actors that we know of. So it's important to understand these dimensions. And in the food system as well, there are many drivers. There are a lot of different drivers from the social, the scientific, the biophysical world, and also the social element and the business side of things. And the fourth one here is that the food system includes a range of outcomes. It's not just to get the foods. It's also, there are trade-offs like the source of income or employment or getting a profit, social capital. It also can be politicized. and then also the interest on the human capital. And then there are synergies in looking at climate change and the impacts of climate change on the food system and food system on climate change. And then water availability, the water quality, and so forth. And this is very important because I'm sharing these 4 dimensions or 4 characteristics of food system so that we can start to understand and appreciate the complexity of working and looking into the nexus of climate change, agriculture, food, water, and so forth. The global food system as well faces profound challenges, and one of those is the equity issue, or the fact that we generally produce enough food to feed everyone, while we have so many people that are moderately or severely food insecure, and many billion people who cannot afford a healthy diet. The second is the number of people living with obesity, excess weight, and associated human health problems is growing globally. And for many of us in the Pacific Islands, we are in the second bullet point. And there's food demand is expected to increase as the population is also increasing, going up to 9.7 billion people up to 2050. So this is another very big challenge for us, is because how could we increase production to feed 9.7 billion people and ensure that we have a healthy environment, a healthy planet to live in as well. So our food systems are vulnerable. So this is like the third point there is important for us to reflect on, is that climate change is one of the many factors. There are underlying developmental issues that we need to deal with in order for us to build a foundation of resilience to climate change and many other stresses. So food systems highly vulnerable, and the food systems also contributes a lot of greenhouse gas emissions, deforestation, land use changes, even pollution and overuse of freshwater layers. As I mentioned, that climate change is one of the many other multiplier. As you can see here, these are some of the vulnerabilities of our islands and our systems to climate change, decrease local food production, and increase the dependency on food imports. And as an outcome, we have high malnutrition, high micronutrient deficiency, and then high overweight and obesity related non-communicable disease. There is the most important point here I want to stress, is that these outcomes here are strongly connected back to the vulnerability. So this is like a cycle feeding on itself. So that we really need to address this and break this cycle as well. There is a perception around the world that Pacific Island food system is very healthy, that we all produce our cassava, our sweet potato, our yams, our taro, catch our fish, go under, swim under the beautiful waterfall, and then eat a very healthy diet. That's because they watch a lot of tourism promotion videos. But this is the reality of our Pacific Island food system. We are relying on imported foods and global food system for food security in the islands. So the availability, the accessibility, utilization as well of some of these foods, and the stability is now within the global food system control at the moment. But this is one of the most important graphics here, is that it's not just about importation. It's about the quality of foods that are coming into the islands. As we see in 2007, there's a decline of the quality of the food imports. That was a response to the global financial situation in 2007, 2008. But the global financial situation has recovered, but our country policies still continue, and the decline in quality of imported foods into the Pacific. And this is really important for us for two reasons, because sometimes there are pro-poverty policies that, like, for example, the zero tax on food items. But sometimes these policies clashes with food and nutrition goals, because some of the foods that have zero tax are some of the most ultra-processed foods that the public health people told us not to eat. So we are normalizing a culture through some of these policies where people will have a taste and normalizing the change of consumption of highly ultra-processed foods that makes it very difficult to switch. On this slide, there are two important realities of food systems or food security in the Pacific. That when we working with the communities and the governments, we always talk about food security, but the communities and the understanding says that we don't worry about food because we are food secure. No one is hungry. So there is a thing in the Pacific where they equate food security to the physical status of hunger. So they say no hunger, no problem. And in the Fijian language, they say "Sengana lenga" or "Hakuna matata." The second one, there is a strong status of food in the Pacific. It connects to cultural, economic development, and the spiritual aspect as well. And these status have legacies during the Second World War and during the colonial times. There is a perception of rice superiority because that was the food of the colonizers in the Pacific. And there's also canned food or tin food because it was the food of the American soldiers who were around. So it's like you're strong like an American soldier who came in the Second World War. So there are some of these perceptions in the food system. So food insecurity in the islands is not just about the lack of food. It is about overeating of one or two food groups, nutrients, and lacking of many other important nutrients. And it's about handling the hidden hunger. And this is the outcome. Some of these in the Pacific, we do have two existential threats. One is climate change, and the second one is non-communicable diseases. And this graphic here shows that many of Pacific 6 or small island developing countries have almost triple the rates of some of these indicators compared to the world. But this is another important element here, the number of those days lost because of diet-related issues. And for countries that are very small, have very small populations, this is very, very serious. And for myself, I'm a citizen of Tuvalu, 10,000 people or 11,000 people. So the public service or those who work in hospitals, teachers, sometimes when they're just getting closer, 40 years or like to the ripe age of service, and then they have non-communicable diseases for some of these issues. And that's a huge loss. So just to quickly go through the 15 food systems in the Pacific. And in here, you can see that there is a food system in rural Pacific where there's very high, still relying on production, local production, especially for Papua New Guinea, Solomon Islands, Vanuatu, and also Fiji, part of Tonga, and Samoa as well. There's very high reliance on local production of food. It's about 60 or 70% of the diet comes from local production, agriculture and fisheries. And then 30 comes from imported or purchased from the shops. These are the systems in normal times. These are the non-disastrous times. And then we have the urban Pacific, where they still eat some food from local production, but they purchase from the market. And the urban is fed by the rural. So the rural population sell the produce at the markets. So the urban population can have access and purchase the locally produced foods. But it's about 40 or 30% local production in the diet, then about 60 or 70%. And then we also have a food system in Atoll Pacific where about 90% are imported. And this is a really important reality because this is in normal times. But these food systems shift after a cyclone or during a drought or some of these extreme events time. This is some of the data that come from Solomon Islands, showcasing what I just said. In rural, it's about 80% local production and also from the wild harvest, from forests and rivers. And then in the urban, it's less than 20% here. So, and the national data or the level from Solomon Islands in the food environment. And this is looking at Honiara, which is the capital of Solomon Islands. And this is a very important graphic because these numbers shift just after the cyclone, about 2 weeks after the cyclone, and then these numbers start to switch. The rural start to behave like the urban, and the urban start to behave like the atolls type of food system. And we're looking into that now to see the speed or the rate of transition from the rural to the urban, or the shift into the more purchased food after the cyclone or after or during the droughts, how fast that shift goes and how fast it goes back, if it ever gets back. And this is another graphic as well I want to share, because hypothesis says that increase of temperature will also lead to increase of many other risks. For small islands in the Pacific, all of these are already experienced at 1 degree Celsius. So all these darker risks here in 2 and 3 and 4 are already experienced here, because climate change exacerbates many other developmental and underlying vulnerabilities in the islands. So the shifting realities here, because of climate change, it will reduce local production, increase the income, reduce income as well, because the source of food is also the source of money, but there is an increased cost of food in some of these countries, as we have seen after cyclones in Fiji. If the cyclone goes to the central area, Suva, where the capital is, the people from the western area of Fiji come and control the prices of vegetables in the markets in Suva. And then vice versa, if the cyclone goes to the eastern part, to the western part of Fiji. And this cycle continues on, and people continue to rely on food aid and remittances. This is an important graphic as well, because it's bringing the reality that in this climate change, it's not just climate change the issue. We also have other natural hazards. We have tsunami, we have volcanic eruptions, and we have earthquakes. We have pests and diseases and so forth. So, but before, we used to know when the cyclones will happen, when the heavy rain will come, the floods will come. We used to be able to prepare for that hazard. It's like a boxing match. We knew when the hands are coming, where the direction they are coming. But in this climate change, it's shifting from a boxing match to the mixed martial arts type of reality, where you prepare for the cyclone, and then a tsunami can hit you, or the drought comes before the cyclone and then continue after the cyclone. So it's like this situation: you prepare for the punch, and then the leg kick you. And this is the reality of our community and the reality of our preparedness, response, and also recovery in the Pacific. Just quickly going through some of the impacts here in the Pacific. Severe impacts when cyclones and floods and droughts are happening on the local production systems. And these are the slow onsets as well, with rising sea level. It's almost no land. But it's important here to know as well the loss of mind or the mental health impacts of some of these hazards on the farmers, and it's intergenerational, this mental health as well. Future climate change impacts is going to be a reduction of the yields of taro, cassava because of carbon dioxide, but then also with increased water stress during droughts, there's an increased cyanide accumulation in cassava that's needed to address. And this is also another factor as well in the Pacific. Some of our local and indigenous communities believe that climate change is an act of God or voodoo, or sometimes they say this is our punishment from God. So there's not enough awareness to look at having some of discussions in this area. And there's also an increased demand for food aid. This is important because in the Pacific, we do have those food security cluster, and there's also a health and nutrition cluster in some of the countries. But some of the food baskets, the contents of the food basket, contain some of the foods that we have been discouraged to consume in normal times, but they appear during food aid times. But then as disasters or as some of these hazards continue, there is more reliance on food aid happening. Just going into a bit of quickly going into some solutions. We're dealing with complex and nexus issues that require a system solution, and not just system in approach, but also at the sectoral, multi-or sectoral, agriculture, health, food, and water, and so forth. So we do have a United Kingdom National Institute of Health Research funded grant that is led by the University of Exeter, but in collaboration with many universities in small island developing states, focusing on Fiji, the Western Philippines, and 2 countries in the Caribbean. This partnership is good because we work, when I say we, meaning they are public health people, work with agricultural researchers, work with agroecological researchers, climate change researchers, community-based researchers, and farmers and fishers who are also researchers to co-design interventions, implement them, and measure them based on the impact on diets, health, and environment health, and also planetary health. That's a link if you are interested to look at that. We also have ACR-funded research that look at improving sustainable agriculture intensification systems for climate resilience in Tonga and in Samoa. So this is very important because this is looking at how can we increase agricultural productivity, increase soil health, increase environmental health, improve diets of local population, and improve resilience at the same time. That is a holistic approach. And this is the last example I'm giving, which is launched the specific action to enhance the visibility of evidence on health and climate impacts, which is a paid project funded by Wellcome Trust, led by Professor Catherine Bowen. Here at the University of Melbourne Climate Futures, we just launched this, we did it in section 2 weeks ago, the Pacific Climate Change Center at Sprep in Samoa. You can see the members of the team, and you from Solomon Islands, Kiribati, Samoa, and Federal State of Micronesia, you will recognize some of your health workers and climate change workers in this photo. And you can recognize me there, standing there as well. So this is a very important example of bringing people together at the policy and also research and trying to get the evidence to move people together. You can also see Galera there from the Pacific community. He's very famous in the Pacific in the field of health and climate change. Just sharing some of the papers here that you could have a look at in your own time, trying to argue this systemic approach, which is, this is a report just launched last year during COP29. And chapter 11 is about COVID-19, community health and mitigating climate crisis. It's freely available online. You can have a read. It's a comprehensive report, 700 pages. It's like the IPCC of the Pacific Islands, but with more traditional knowledge and community evidence as well. And these are some of the papers that you can also look at. But I just want to land with some important food for thoughts that climate change exacerbates and multiplies existing vulnerability. So we do have core developmental issues. So we look at climate change not as an isolated issue, but we need to weave and build our resilience, the development lens, to make it a resilient development approach. There are non-climatic events such as natural hazards in the Pacific. We cannot look at climate change in isolation from many of these natural hazards that are happening and some of these stresses that are happening in our communities. We have to develop those strategies that encompass fighting all of these at the same time. The multi-sectoral approach is needed and be involved beyond the health sector. And we need to develop some of these MOUs or strategic or some of these SOPs and policies overlaps. It's interesting because we were in Samoa and there were discussions. We look at the climate change policy, there is an activity, review the Ministry of Health climate change strategy. And then the list of stakeholders, the Ministry of Health was not listed. And then it says, oh, that's quite very interesting. So it's important to have a seat, find a seat there. Disaster response needs to focus on the bigger picture, just not trying to respond to the need at hand, but have a much bigger strategy so that we're not just encouraging the consumption of ultra-processed food, but also looking at greening the humanitarian response to make it less waste and not creating more health issues post disaster. Because in our situation, after one disaster, we prepare for the next. So it's about building resilience and a stepwise approach. But if we're not doing it right, we keep falling back to ground zero. And this is very important for us. This is a framework that was developed by the Humanitarian Advisory Group here in Australia with Pacific Island countries. NCD is a priority in words only. This is more of a lip service, not much in the 2050 Blue Pacific strategy. There are only 2 mentions of non-communicable diseases as problems. So the solution-wise, it's not really there. So it's time to think of how we could look at, not just at the national, but also the regional level, to mobilize resources. Because NCDs have been classified as a major issue like climate change, existential, but it doesn't have much attention, like the attention given to climate change. So working on these 2, please, you have to work to elevate the NCDs to mobilize more resources to do all this, because it's not just about acting, it's about doing this. And doing this, you need resources. Other security livelihoods are very important, including land, cultures, and water security. And this is very important for us, for me to end this lecture as well, because in these Pacific Island countries, most of the population are indigenous people. They own 80% of the land in most of the independent countries, and also the fishing rights. So the culture and the cultural governance is very, very important. So we need to work through the cultural governance processes as well. And water security is very important. And I am looking forward to have a much more discussion with you after this session. And thank you very, very much for the opportunity. Thank you. Pastai Lama.
Thank you very much, Vili, for that very comprehensive and rich presentation. And we look forward to our conversation in a short while. Now let's listen to Victoria. Victoria will also present a case study. Over to you.
Thank you. And let me just share. All right. Can everybody see that? Are you seeing the presentation screen? All right.
Yes, we do.
Great. So thank you for inviting me here today, and Vili for that great introduction and overview. As said, I'm a senior research fellow at the East-West Center in Honolulu, Hawaii, and a research professor at Arizona State University, remotely from Hawaii, of course. And I do a lot of work on hydrology and climatology and the impacts throughout the Pacific Islands. So I'm going to start today by giving a little bit of an overview of the types of climate variables that do impact food and water security in the region, and what we've observed in terms of those climate variables that affect food and water security, and how those trends might change in the future and how they might change those systems. Then I'll give a couple case study examples, and I've tried to put some action points for health responders in my case studies to try and give the case studies and the science a little bit more applicability to where people are coming from. So I wanted to start off, this is a figure that we produced for the US National Climate Assessment for the Hawaii and Pacific Islands chapter, that is a cartoon looking at the indicators of and impacts of climate change throughout the Pacific Islands. So this one is looking at the indicators of climate change. So these are the things we track in the system that are changing. They can be things like carbon dioxide concentrations rising, surface air temperatures rising, sea levels rising, or ocean warming. And again, those are those things that we're tracking over time, observations, and that we're seeing shift. The impacts, however, are the consequences that we're seeing from those changes. So very relevantly for this session, new diseases, risk to human health, more intense and frequent heat waves, increased invasive species and wildfires, impact to crops and food security, shifting fisheries and biodiversity loss. So those impacts are really the changes to ecosystems and communities that we want to try and adapt to and reduce the risk through climate adaptation. And I just wanted to stress that mitigating the causes, so stopping the reason for climate change and adapting to those impacts that we can't stop at the local level is urgent. But we do know the solutions. We know how to mitigate climate change by stopping burning fossil fuels, and we know how to adapt to the impacts that we're already seeing, and we know what's going to be happening in the future. We just have to motivate the political will to do it, which is, of course, the most difficult part. I also wanted to show this. So one of the main climate phenomena that impact climate variability on a shorter term or seasonal scale throughout the Pacific and really across the world is the El Niño Southern Oscillation, or the ENSO, which you may have heard of in your region if someone says it's an El Niño year or a La Niña year. And what that does is, when we're talking about 100 years of climate change into the future, that's not so helpful for planning on what's going to be happening next year or next month. But when you're looking at a shorter scale, the El Niño Southern Oscillation is really more helpful for planning for climate impacts on a monthly to seasonal or annual scale. And what we see in the Pacific is that in the North and West Pacific, during a El Niño event, there's less precipitation, so it's drier in the Central and West Pacific. There's more storms. The sea levels are lower, and they're high sea surface temperatures. And really, what we see in terms of impact of that is more droughts, more coral bleaching. If cattle might be cold during a drought, and during a La Nina on the other side, which is the opposite kind of impacts, it's wetter in this kind of horseshoe shape in that bottom figure, where it's wetter in the Central and West Pacific and then drier in the South from that December to February following the La Nina event. And there are high sea levels throughout most of the region. So really what you can see is this provides a lot more predictability in some cases. So it can be easier to manage from a health and food and water perspective. So just as a summary, you may have seen this before in one of the other talks, but this is from the WHO regional office. In 2019, Dr. Kasai, who is the regional director, said that climate change was one of the top 3 threats to Pacific Island health. And so overall, they're both mental and physical health impacts from climate change. And these range from direct exposures, so things like changes in injuries and deaths from extreme weather events or vector-borne diseases, to injuries from natural disasters. And this is a nice schematic of kind of some of those changes that we see in this from the WHO. And I won't go over this too much because I know you've already seen it. We've seen something similar, and we've heard from Vili as well. I just wanted to give you now some of these changes and observed trends that we are seeing, so we can go into that with context into the case studies. So in this slide, we're seeing, this is a report that we did. The citation is there at the bottom of the screen, and I think everyone will have access to these slides. But this is looking at trends in the numbers of hot days and warm nights across the regions. And this is from data from 1951 to 2020. And so this map is showing a change in the percentage per decade in the annual amount of hot days. And I believe we classified that as over 90 degrees Fahrenheit. So that shift to the warmer climate in the Pacific, we're really seeing more extreme daily heat events and fewer cool nights. So again, these warmer colors, the reds and the oranges, indicate areas where you are seeing more increases in the annual number of hot days. And if there's an X in that weather station, it's a statistically significant trend. So these extreme temperature events are also increasing in frequency throughout the region, and that increased heat is really stressing human health, agriculture, aquaculture, tourism, and ecosystems across the region. So as you can see, there are no places that are getting cooler. In terms of precipitation, so rainfall is actually more variable than temperature. So there's some drying across the region and there's some increased extreme rainfall. And this is still looking at trends from 1951 to 2020 from weather station data. So in the Central and South Pacific, there's a trend towards longer periods of low rainfall, and that's measured in annual consecutive dry days, so days in a row where it's not raining. In terms of islands that are experiencing heavy rainfall from that same time period, you see it's more variable and there are fewer significant trends. There are a couple areas in the Southwest South Pacific Convergence Zone, or the SPCZ, where annual heavy rainfall has increased, and a couple statistically significant areas of rainfall increase where we see more drought and flooding damage that are increasing and threatening health. So now to go on to the first case study. So I wanted to give a couple examples. As we heard from Vili, especially in the Pacific Islands, we know that food systems are highly vulnerable, and we've learned that many small islands import up to 95% of their food, which makes it really critical to improve ways for communities to manage their climate risk, to produce sustainable, healthy local food. And what I'm going to talk about is this project, and climate early warning systems, or CLEWS, is one way to help communities manage that climate risk. So this is a project that we've been working on for agricultural early warning systems, climate early warning systems, or CLEWS, in Palau and the Marshall Islands. And so the objective is to use that climate data to minimize our impacts on health, livelihoods, ecosystems, infrastructures, and economies. And what CLEWS can be, it's a variety of tools that use communication, models, observations to help people prepare for climate hazards. So here's an example of one of them. This is a Marshallese traditional agroforestry calendar. So it around the outer ring are the months of the year in Marshallese, and this combines climate data and traditional harvest times of perennial crops. So the main things that people would look for in terms of climate data within those seasons are rain. So if it's a more intense blue, there's more rain. And here's the less rainy season in the Marshall Islands on the left side of the calendar, or wind. And then how that affects the breadfruit and pandanus harvest. Now, one of the other climate variables associated with this, so it's a web-based tool, and there are two versions depending on the status of our ENSO condition. So if it's an El Nino, you click and you can see what your harvest looks like and what type of weather conditions there might be. And then if it's a La Nina, you get a different type. So that's just an example of a type of tool. What we've been working on in a Green Climate Fund funded project with about 75 other partners throughout the Pacific are these climate services workshops around agricultural early warning systems. This one is in Palau. And so we really wanted to work with stakeholders in the agriculture and health sectors to map these climate impacts in the communities and those sectors and support decision-making and early warning. So one of the key messages here, so you can see in our workshops, we're mapping flooding on these maps in Palau here. We've created a kind of a cartoon of what people were talking about in terms of the different climate impacts on different sectors from the stories being told and shared at the workshop. We went out recently and toured a lot of the taro fields with local farmers to get a handle on some of the knowledge that could help them create inform a climate early warning system. And we tried to meet with people across government, nonprofits, academia, farmers, and other groups. So being really trying to be very inclusive and get all information as needed. So here's our prototype that we've put together of a dashboard that gives us some information, some climate early warning information that can be applied to taro fields. And so we found out that they're rolling harvest and planting cycles, so it can happen throughout the year in Palau, and that most are rain fed. So we wanted to have a rainfall outlook dial. So you click on a location and it gives you your last month rainfall, your current, your forecast, and your outlook. So that's looking, 1, 3, 6 months in advance. Same with temperature. Of course, this is the beta test, so it's not looking great yet. We still have to review it and change it. Wind, how wind might affect when it's flattening the taro leaves. And like I mentioned, what season we're in now in terms of ENSO and what the outlook is. So right now we're in a La Nina, and in the next 6 months, we're looking to transition to a neutral. So not a La Nina or an El Nino. We also have the sea level on a daily basis. So your high tides, your low tides, and how that might affect coastal taro patches. And this is just another example of how lunar calendars can be used to map different types of conditions for planting and harvesting and mulching as well. So really it's using that climate variability and climate change information to help reduce risk for agricultural users. So in terms of actions, what does this mean for you as a health professional? So think about if climate early warning is possible in the place where you're working. And again, you might be looking for a climate outlook or a seasonal forecast rather than a long-term climate change model. So if ENSO is a signal where you are, that El Nino or La Nina, you can talk to your National Meteorological Office, your Weather Service office to get more information about how that affects the ENSO effects where you are. And you can look and link that to 3 or 6 or 9 month climate outlooks. You also want to think about what thresholds would call for action. So for example, how long does it have to be dry, the number of days of dryness before you start experiencing a drought? What happens at a 3-month drought? Is there a threshold that would be reached in the place where you work? Does the reservoir reach a critical level? Do household catchments reach a critical level? Or on the other hand, what are the flood levels that would damage the road? How much does it have to flood? How many inches before the road to a hospital is closed? And then lastly, identify champions within the agencies that you would need to work with to share data and to plan for an event. So if you're working on a health climate early warning system, maybe it would be good to get an MOU early with the Ministry of Health or the governmental health office to be able to share data. So when the time comes, you'll be able to use it to identify those next steps. So this next case study I wanted to touch on just very briefly. So this is from the island where I live, Oahu in Hawaii. And it's looking at how heat effects and heat indices in urban areas especially can be variable. Excuse me. On this day, this was August 31st of 2019, and we had community heat map volunteers go and drive all over the island and map this one day, the afternoon heat index. And so what I wanted to show here was, of course, that heat is one of the biggest drivers of drought index as well, which affects all sorts of health and food impacts in a place. So climate change is increasing the frequency, intensity, and duration of heat waves and extremes. And so on this afternoon, this random afternoon where we did the heat mapping exercise, the maximum recorded heat index was over 107 degrees Fahrenheit, which is very hot, especially for Hawaii. 82% of heat-related deaths in Honolulu are already attributable to climate change. So this is through attribution modeling. And an increase in the incidence of vector-borne diseases has been linked to these increased drought and flood cycles that we've seeing are reflected in the data that I showed you. So in terms of looking at heat and human health, has there been heat mapping where you work? And if not, would it help your planning to identify the hottest urban and rural areas or the coolest urban and rural areas? So you can also look at protecting human health via implementing flood design standards, identifying flood impact thresholds in critical zones, like I was talking about before. What are those thresholds where you start seeing harm? You can develop criteria for identifying contaminated sites. So if there's rising sea level or flooding, if the water gets into an area, would that be at risk of spreading contamination? And prioritize minimizing health impacts to frontline communities. So what are the communities that are going to be affected first, that have the fewest resources to adapt or mitigate to them by themselves, and prioritize helping them reduce their risks. Lastly, the last case study I wanted to touch on was community engaged flood modeling. So this is looking at water resources. So the objective, and this is one we're actively engaged in, again on Oahu and Hawaii, is to advance regional adaptation by filling critical gaps in flood risk information and strengthen the capacity of overlooked communities to engage in those decision-making processes around flood adaptation. So a lot of the tools that we're looking at here include participatory flood mapping. So this is just on a phone, this is an app, and when it floods, you can report it just on your phone and take a picture of it. And then we have very specific impacts that can be used to validate these flood models. We're also looking at installing flood cameras on infrastructure around sensitive areas, looking at community vulnerabilities and adaptation priorities with participatory flood mapping and interviews, and then doing some community engaged modeling along the way. And what we want to do is identify and communicate those drivers of flood risk after we do that modeling. So using these different scenario-based flood models under different levels of current and future projected sea level, extreme rainfall, and tides, to really work with the communities that are being affected to understand and map critical areas and flooding hotspots, as we're calling them. So what are some ways of dealing with that as a professional? Well, number one, evacuation thresholds and routes. So when the water is rising, which are the safe ways to get out of a given community that's at risk? Which infrastructure could best be raised? What kind of protective natural nature-based solutions could there be? Of course, there are more traditional coastal engineering projects, river management, connecting drainage to move water out more quickly, and then looking at things and policies like building and zoning regulations. So lastly, I just wanted to end with some best practices that you could have to deal with climate, food security, water security, and health as professionals working in this field. So again, it can be really helpful to introduce yourself to the local meteorologist and weather service office. Is there an extension agent in that office who works with local partners, with farmers, with coastal managers that you can work with to learn more about if ENSO is impactful in your area and how far you can predict in advance? We can look at clues to be applied to a given problem, those early warning systems, if you have that data, but recognize that adequate data is also a problem. So figuring out early on if you can share data with different agencies can be very helpful. Also, you're probably more interested in projections of short to medium term climate variability rather than long-term change. So again, those ENSO scales of monthly, seasonal, or annual outlooks, rather than those models in the IPCC that are often projected decades to centuries in the future. And there is a lot of signal in the Pacific Islands to ENSO. So you can link this to drought and flood, storms, ecosystem health, and even violence. So it's very relevant to a lot of different health questions. And then finally, find champions in the sectors you want to work with. That can be a national heat officer, a vector-borne disease researcher, or even just a community advocate who's very enthusiastic. We find that often the reason an entire project works is because of having that effective champion in an organization or a community. And thank you. And I look forward to taking your questions with Billy.
Thank you very much, Victoria, for those two powerful case studies, and really, these case studies demonstrate, what can be done to address, the challenges that are brought about by climate change, and the impacts on food, nutrition, water, and ultimately human health. And maybe later we can unpack them more. So maybe we can now invite Vili as well, to engage with Victoria and me in a conversation. And we will try to cover as many questions in the remaining around 20 minutes that we have. What I'm going to do is I'll try to also combine some of the related questions. I'll annotate some of them so we can, cover a lot of different topics. I'm reminded actually by listening to your presentations I'm reminded of a paper or a commission that was published in 2019 describing the food system as as being at the very heart of this syndemic of climate change and food and nutritional insecurity. On one axis, you have the nutritional challenges. We have weight and obesity and overnutrition on one hand, and you have undernutrition and on the other. There's a maldistribution of food across society. And on the other axis, you have the food system being both vulnerable to climate change and susceptible to the impacts. Many of you already described them, to heat, to extreme events. But also on the other hand, our food systems contribute to the climate crisis because, these systems use a lot of energy, land, and water. And so, the food system is really at the very heart of, the poly crisis that we are addressing. And maybe to start off, one, question, and, several of our learners asked the question in various formats, but really it's about, the food system is part of the economy. And I think, Vili, you were the one who mentioned, this dichotomy between, a market-oriented kind of food system versus something that really centers sustainability and local production. So, these are two different visions or realities even of the food system. Maybe you can speak about, how can we really is it transitioning back to that more sustainable way of food production, that is local and even engaging, indigenous communities, local communities, and away from this market-driven approach, to food production and consumption. And maybe, and this is for both of you, how can our health professionals that are part of this course engage and address the commercial drivers of food production and consumption, which, by the way, are also the drivers of climate change. They're the ones polluting and emitting the greenhouse gas emissions, and so on and so forth. So maybe you have some thoughts on this. I know it's a big question. Vili, maybe you can start.
Thank you, Professor. Can you hear me?
Yes.
Yes, and thank you everyone for the wonderful comments and the questions. For time, I will try to keep it short. Yes, because you're right, it's a very complex system, and the question you're asking is an excellent one because it goes right to the core of it. What can we do about it? And I think you started it by talking about localization of food production and trying to get back to localized food production. There are quite a lot of interventions that look at that, trying to increase local production at the household level and the community level. And the assumption there is that increasing local production, increasing consumption of local foods, reduce purchases or spending money. But there are two key things that I would like to add on the discussion here. Yes, it's good to increase local production for those who have land to increase local production. In the world now, there is very high urbanization. Find a way you can grow your crop or you grow your own food or vegetables in an urban area or even in an atoll. But there are two things here. One is as the climate change lands on it, because the traditional way of production of this local production is not focusing on the food. It's going in the traditional way of saying, like, let's make a home garden, and then you go and plant 4 different types of root crops because you're thinking of the market you can sell. But it's important to do the home garden and then thinking of food first. It's for your food first, and then how you develop the sustainability of that garden. And that is very, very important because development of that sustainability ensures that the location of your garden is away from the flood area, or it's like high. There are vertical gardens or some of these things, technologies that can be used. We learned in COVID-19 response, when COVID-19 came, there was so much joy because people started to go back to planting their own and growing their own food because shipping was not moving. It was a really good approach. But we learned from the study that we did before, during COVID, was that dietary diversity of diets went worse. Because yes, there was really increased high production of local food, but they were all of the same food group. There were 20 different varieties of starchy food that was produced and all waste, but there was no protein in the diets, no other important vegetables or fruits. So it's important, if you go local, diversify it and focus on the food. And the second part, just to quickly address how can health the workers engaged in a trade, it's a very important question. And I know timing is an issue as well for the time of the health workers. But please get in front of the trend. To all the health workers, don't wait until it's bad, and don't wait at the hospital. I have some colleagues in Fiji, they said, I'm waiting with a saw to cut your leg when you have NCD. I said, get in front, go and have discussions with the customs and be part of these policies on trade. Get a seat at the table and provide that health lens and that health light bulb to inform decisions for policy makers. Don't wait at the hospital. Go, as my colleague Victoria said, go talk to the trade and custom. Provide the advice to some of these trade and be part of the change in the climate change arena and also in the supply chains discussion and the trade. Yeah, thank you, Bro.
Thank you, Vili. Victoria, do you have anything to add to this question? Yep.
We can go on to the next one.
Sure.
I know time is short.
Okay. Yep. Wonderful. So one other question that has been emerging is, around, there's one question about the importance of water, and the centrality of water. And maybe this is something maybe you, Victoria, can respond to, because when we talk about, the future food system, the food system relies on water in order to produce our food, but also we consume water directly, right? That's in itself, it is an important resource. And unfortunately, climate change is worsening the water situation, but also we have lots of unsustainable practices in the way we consume, distribute water. So what's your forecast in terms of the future of water, and how can we be better stewards of water, and maybe even at the level of healthcare, because healthcare also uses a lot of water. Many health professionals in the audience may be interested. What can we do within our own backyard?
Yeah, very big question, of course. But let me start from, if you remember that map that I showed at the beginning of my talk, looking at different trends and different variables across the region. One was that we were seeing both increased dry days, so increased drought, but also increased rainfall. And about the annual average amount of rainfall across the region has been about the same if you just average out all the variation. So it's really not a question of, if the water, the fresh water that we have is changing, is going away, it's drying up. It's that it's coming to us in different ways than we're used to. It's dumping down all at once and running straight off into the ocean, so we can't save it all, causing a lot of damage, things like that, or it's not penetrating the ground because it's crusted over because of drought and running off. So really it's about how to save the water for when we need it. And using as much as we can of climate forecasts or seasonal forecasts to be able to minimize that risk of big rains and extended drought periods. In terms of balancing kind of our uses into the future and being good stewards, the best way to begin good stewardship is to know what you have. And what we are doing is losing the kinds of observations on the ground where we do have those really long time series of data that tell us how specific water resources are going. So I have another graph somewhere that looks at stream monitoring stations long-term in the Pacific and how the numbers of them have gone down since the early 1900s, when they were a lot more used for like plantation and sugar and farming throughout the region. So we're losing our eyes on the ground of what's going on with fresh water at the time where we need to know exactly what's happening even more to be able to project to the future. So that's kind of a long explanation to advocate for more observation so we can be better stewards of the water we have by knowing what there is, how much we need to save, and when to use it. The last thing I'll say is, although we have very high elevation islands in Hawaii that keep a lot of that fresh water stored in the volcanic mountains, we aren't used to thinking about Hawaii as being short on freshwater resources, but as Vili noted, with compounding extreme events happening more, what we were able to see in Hawaii just last year was that another disaster. So for us, it was the spilling of jet fuel by the U.S. military in Red Hill in our main urban water supply aquifer, really damaged our ability to project out future freshwater for the entire island, so that you can think that you have a safe supply, but one disaster can change everything. So compounding events can really throw a wrench in all of your planning, despite your best efforts.
Thank you, Victoria. We have more questions in the list, and I'm actually picking the ones that perhaps have not been expounded and discussed during your presentation. So one is, there's interest regarding this campaign or advocacy around a return to indigenous diets as part of addressing climate change and ensuring food security. So maybe Vili or Victoria, you have some thoughts on how can we better integrate, I don't know if that's the right term, integrate indigenous diets and food systems and ways of food preparation, for example, into the more mainstream food system that we have, and how can we use that as part of, again, addressing the climate crisis. Anyone? Just feel free to jump in.
Yeah, thanks, Prof. I think I'll start. Yeah, there's always a very interesting discussion on getting back to the indigenous food system. But often I ask the question, what is it? What is the indigenous food system? What is it exactly? Are we talking about the pre-colonial time or the pre-missionary time, or what is it? So I think for me, it's more of getting back to the indigenous people's food system rather than the indigenous food system. I say this because I work with indigenous people's food system across the Pacific and also starting in Australia. And one of a friend of mine who's in indigenous Australia says, "Oh, really? Every time I go to the indigenous food system workshops, they try to feed us with the indigenous foods. These are some of the trees, the fruits, and some of the teas." And then I ask him, what do you think? And then he says, no, they should know that I can also eat McDonald's. And I think this is an important statement, because one is, I agree with the intention of getting back to what it really means is to increase the local production of food, to eat from the local production using sustainable approaches. But it also means there is a change of status of food and the perception of food within the indigenous community. And to me, that is a really big factor, because we can have as most colorful indigenous fruits and some of these things on the market. But if there is no demand or interest to consume, then we continue to have the issue. Couple of solutions. One, the NGO Foundation of Rural Integrated Enterprise and Development in Fiji, Fiji, they have these restaurants, tukuni restaurants, that they sell local foods, and they train the chef using traditional ways of cooking, traditional way of preserving foods, so that it's trying to bring back the status, making local food cool again. And then it's on YouTube and some of these important comms subjects. The second important part about it is that the education element of it. It's not just about talking about being proud and go back to it. It's much bigger than that. It needs sustaining resourcing, sustaining knocking on the door for this generation and the next generation and those generations to come to make it happen. At the household, at the community, at the school canteen, and also right at the policy level. So it needs that kind of approach, rather than trying to do a piecemeal, because it's much complex and bigger than that. But I totally agree with the approach, but it needs to work together. Agriculture guys who produces work with the Ministry of Health to inform the kind of crops or fish or protein sources to work with the trade guys as well. So, and local community leaders in the Pacific Islands, local governance is very, very, very important. If the chief says we're not going to eat the corned beef tomorrow, that can change. So this is kind of like top down at the community governance level. If they say, when we meet, don't bring the corned beef, don't bring all of these processed foods, but when the village meets or the church meets, I'm expecting to see some of these good local foods, local yams coming. And that's the systemic approach. Thank you.
Thank you very much, Vili. Victoria, please feel free to jump in.
I would just like to link that to one of the other questions that's in the worksheet, and that is thinking about how to create transformative change, whether it's changing food systems and the type of food that people gravitate to, or how to get a policy uptake or a tool uptake in an organization or a government. And I think there are a couple strategies that we like to use to encourage that. One is like a co-development of a process. So working with a given community, working with an agency or a department, working with a government or a sector of people to develop the questions that you want to answer, to involve them in the research or the project, to help to talk to them throughout and iteratively shape the product that's being created, whether it's a tool, whether it's a different system of agriculture or a different type of food, and creating that education and co-development of the project with people. And then linking that to, so someone asked how these tools often lack uptake at the community or government level, especially, significant ones that are tools that are developed by NGOs or academics that come in and create something and then don't transfer it to the community and leave. And so, creating that link with a group of people on the ground that you're working with, so they're, taking ownership, and like I mentioned, finding that champion in your sector to work with, whether that's in a specific office. I think probably everybody, all 950 people on this call know what I'm talking about when it's like, find your champion in the project where you're working, because that person is going to be the key to making everything stick. And hopefully you'll have a couple of them, but usually I find there's one person that you really just have to connect with.
Wonderful, Victoria, and thanks, Vili, for your reminders regarding this, the discourse around indigenous diets. we have around 4 minutes remaining. And actually what Victoria, you were beginning to talk about is a good segue to this last portion, because many of our learners in this room, and you highlighted, we have around still 900 colleagues from across Western Pacific still staying on Zoom. So that's amazing. Many of them are clinicians. Hopefully we have nutritionists in the room. They deal with patients. They are in healthcare systems, hospitals, public health agencies. And they want to make a difference, including in the area of food and water systems. And, one may reason out that this is beyond the ambit of the healthcare sector, right? It's another sector that's responsible for the food that we produce and consume, the water that we consume. But, we're already starting to talk about and you're already starting to mention that we do have a role to play, even as health professionals. You mentioned some of the tactics already, right? And it's really about reclaiming, the control and the governance of food, and putting it on our hands and not just waiting for whatever the quote unquote market is pumping into our households and into our kitchens. So maybe to close this session, you have some, additional reminders or tactics or strategies. For example, there's one question: how can we engage community health workers who are in the front lines? How can they be the messengers of these important messages, for example, to the families and the individuals that they serve in the community? There, again, I said, maybe there are nutritionists, maybe there are hospital administrators here. There's even one question: how can we talk about these difficult and complex issues to our patients? So I think that's a very good last question for this session. And please jump in, whoever wants to start. And maybe something more concrete and tangible for our learners.
Okay, we don't have much time. There's a couple of things, but thank you. It's really, really, really good questions, and thanks for moderating this, Prof. Excellent moderation. Just a couple of things, practical things. One is time is a factor, and in small island developing states, we do not have many staff on the ground. Not saying in the rural as well, and sometimes budgets do not really prioritize dietitian or some of these important health workers who can connect the health to the production or to the food element. And I think so. The few people who are still working already have their job description aligned, and then going outside of that is another extra load. It's another added load, and I think it should start from there. It should find in those job descriptions an opportunity to describe this interconnectedness of roles, so that it's not added on when you deliver something. It's a part of your own JD, and then part of that is to prioritize from the government and also donor agencies who work with governments. You can also work with the governments to provide more money in order to hire more dietitian and nutritionists, those people who are working on this space, so they can be in front of the issue, not always to be responsive every time. And the last one, sufficiency. Sufficiency is one key word in my mind, sufficiency of resources. And sometimes these governments already do not have many. So they try to budget to go like this and prioritize. It's more like what's the worst of the worst option we would take. And most of the countries, when it comes to climate change and health, they try to go for funding, external funding, like Green Climate Fund, like some of adaptation fund. And some of these resources, it can take a very long time. And the key narrative there is hard to access. My advice is that if you are involved in this or working with agriculture or health, do two things. One is that form the multi-sectoral approach, budget some of these positions in these 5-year, 10-year programs. And then second, go for the most highest amount of money you could get. Do not be satisfied only with the 24 million. That is nothing if you put it on practicality on the ground. If you can go for 100, go for 100. because that is the key here. To do these complex systems to adapt or to mitigate climate change, to reduce the risk, you need sufficient resources. And if it's hard to get, then make sure when you get there, you receive the most amount of money you could get. Thank you.
Yeah, we're just on time, but maybe Victoria, you have a quick advice.
Very last point is my advice would be to meet people where they are and talk to them, get into the conversation about climate and health or whatever you want to focus on by finding out what they are an expert in, because people love to talk about what they are expert in, as you can hear from our conversation today. But that's how to connect with people and then take what they're doing, where they're passionate about working in their community, and translate it to what you're trying to work on with climate and health.
Thank you so much, Victoria and Vili. I'm reminded of this saying that if you were able to eat today, thank the farmer who produced that food. And so I think that's a very fitting reminder to all of us. Let's get out of our clinics and our hospitals and talk to our farmers, our fisher folks, people who work in the water sector, and our communities. And as you mentioned, build the coalitions and work with all different sectors to advance, the nexus of climate change, food, water, and health. Thank you, everyone, and see you in the next session.
Thank you. Thank you very much.
Thank you. Thanks for everybody sticking around.
Thank you.